Okay, in this video, we are going to talk about specifically equine dentistry. Up till now, in the previous lectures, we have talked about the veterinary dentistry basics that included all of the animals we commonly deal in the clinics. But now we are going to specifically talk about equine dentistry, and this is basically divided into two lectures. This is the first lecture in which we are going to talk about equine tooth anatomy. First thing in anatomy is that what are the types of tooth that are present in equine. Those are same incisors, canine, premolars, and molars, but in between we have a first premolar that is called as wolf teeth, and we know that wolf teeth are premolars in upper and lower dental arcade. These are the first premolars, but they are vestigial and they have no function. Next thing we have is infundibulum. What is infundibulum? That is found on an equine tooth. Basically, infundibulum is an infolding of enamel into the center of tooth, forming a funnel-shaped cavity which is filled with cementum. You can see this picture, which is taken from Pasquini Anatomy, and it is a very good picture. If you see this, this is a picture of equine tooth from the side. So you can see this infolding, which is called as infundibulum, and it is filled with this cementum. So um, this is a side view, but if we see the same tooth from the chewing surface or the occlusal surface, you will have a shape like this. And what is this? Basically, this structure that is marked is the cup. So when you see from the side view, you see an infolding and we call it infundibulum. But when we see the same infundibulum from the chewing or occlusal surface, the mark we see, we call it cup. So cup and infundibulum are same. And each incisor has one infundibulum that is also called as a cup. During lifetime, infundibulum wears away until it completely disappears. That means that as the tooth in equines, they grow as well as undergo wear from their chewing surfaces, because these are grinding animals. They chew grass all the time. So their upper surfaces of the tooth are always in the process of wear. So what will happen that the upper surface will keep on in wear. So the infundibulum, after some time of life, the infundibulum will disappear. Next, we have seen the infundibulum. Okay, that is the infolding of enamel. We have seen the cup that corresponds to enamel, seen from the chewing surface. Next, we have is dental star. What is dental star? Dental star corresponds to the pulp, yellowish brown secondary dentin that fills up the pulp cavity. Okay, let's understand this from this picture. This is the same picture, just the full view. Now you see that this is the infundibulum, and this is the side view, and this is the view from the chewing surface. So um, you can see what is this. I can draw this or mark this area particularly. So okay, what is this? This is a cup. Again, this infolding is cup, and now at this level cup is very visible. This infolding is cup. Now as a tooth undergoes wear, like this portion is gone, this portion is gone, this portion is gone, now this portion is gone. So with the passage of time, the infundibulum or cup will wear away, but now as a tooth comes on this place, now you can see over here. Let me take some other color. Okay, this red area, what is this? Basically this is the pulp cavity. So the pulp cavity, you can see that the pulp cavity will start to appear on the surface or get exposed on the surface as the tooth will start to wear from the top to the bottom with the age. So at this point, you will have on the chewing surface two marks. First mark will be this cup, and the second thing that will be exposed is this pulp. So the we know this is cup, and later on, when at this stage the cup is called as enamel spot because it is about to get disappear. And alongside you will see this black mark. What is this black mark? Basically this pulp being exposed. So uh, cup will convert into enamel spot, and enamel spot will soon get disappeared because in the later two of diagram pictures you can see no enamel spot or cup. So cup will convert into enamel spot and then totally disappear, and at the same time dental star will start to appear. What is this? This is dental star, this structure and this structure. So what is dental star? Dental star is something that corresponds to pulp because this pulp is being exposed. It is a yellowish brown secondary dentin that fills up the pulp cavity. And why this dentin fills up the pulp cavity as it gets exposed? Because if directly pulp will expose and dentin will not fill the pulp cavity, then what will happen? That we know, we have studied in our previous lectures that the pulp cavity is very sensitive. It has blood vessels, it has nerves, so it has lymphatic vessels. So this is a very sensitive area. If it will expose and dentine will not fill this cavity up, this will be painful. The teeth will become painful with the passage of time or as horse gets age. So what does nature do? That it fills the pulp cavity with the dentine, and you see it as a dental star. So I hope you have understood the difference between an infundibulum, the cup, enamel spot, and the dental star. Next thing is triangular surface. What about this surface? It is a simple thing that as age increases, chewing surface becomes triangular. Like you can see, a young horse will have. I can change the color. Okay. Now I'm using the green color. In a young horse, the shape is somewhat like this. Now you can see it becomes bit rectangular. Then it starts to become triangular surface. And as age keeps on progressing, it becomes a proper triangle. These are triangular surfaces. So you should see the marked difference between, or you can see this. Uh, if you see a horse that has triangular surface of the tooth, and another horse that does not have a triangular surface of the tooth, you can clearly see and tell the people that which one is more aged. So it is one of the important factor. So next, what we have is some other terms. Now, here we have the first one is anisognathia. That is a property of equine dental anatomy, you can say. Anisognathia means that the upper and lower jaws have different widths. Uh, okay, you can see this is the skull of a horse, and you can see the marked difference between width difference between upper and lower jaw. So this property is called as anisognathia. Like if you see your own mouth as humans, whatever the width of the upper jaw is, we have the same width of our lower jaw, but that is not the case of the horses, and that is why the horse has circular chewing motion to utilize its uneven jaw. Like if an animal has upper and lower jaws of different widths, that means an animal cannot eat on the both sides. Like we humans can eat at the same time from our both jaws, यानी कि हमारा खाना हमारे दाएं और बाएं दोनों तरफ मुंह में दांतों के बीच में हो और हम उसे चबा सकते हैं, बट horses cannot do that. They will either eat at one time from their right side or from their left side, but they cannot utilize their both jaws at the same time. So, um, there is another thing that restricts this thing, that horses have severe waveform in premolar and molars, which restricts the forward and backward motion of the jaw. You can see that the equine does not have a smooth curve of the teeth. They have like random ups and downs in their teeth, so that restricts their normal forward and backward movement of their jaw, and because of that they have restrictions in eating. And how they eat? Horses chew only on one side of their mouth at a time, either to left or to right. Jaws move in angles over motion guided by molar table angles. Like, what does this mean? First thing, they eat on one side at a time. Next, they eat in an oval motion like this. So, I sorry guys, I have a bit of internet issue over here. Okay. So where we yes. So horses eat either from their right side like this or from their left side like this. So next, what we have, yes, interdental space. In horses, they have an interdental space to increase in face length, allows horses to graze whilst being able to look out for their predators. Um, you can see the skeleton. Now, what we have over here are incisors. Next, this is canine, and we know that horses are sexual dimorphic in as far as canine teeth are concerned. Like, they are present in male horses but not in the female horses. Next we have is premolars and molars, and they are here. Like, their teeth are not are not arranged like our teeth or any other animal. Like, our teeth do not have space in between, but horses have clear cut this much space, and that is called as interdental space. That increases their face length so they can graze while they can view their predators. Second thing is that this interdental space also helps us as clinicians, that we can insert our hand in the horse mouth from this interdental space. Like, our hand will be like this, so that we can get a hold of their oral cavity as well as we can avoid their bite. Next, horses have a deep. So this deep jaws in horses help them to accommodate their hypsodont teeth. We have studied in our previous lectures what are our hypsodont teeth, what are brachydont teeth. You can see the concept of these terms from there in a better way. So, but hypsodont normally means that the teeth that have long. Hypsodont teeth have long crown, and they are longer than brachydont teeth. We have recorded a separate video in previous lectures between hypsodont and brachydont teeth. So if you haven't seen that video, or you don't have any concept about these terms, you can go and watch those videos. But here we have seen interdental space. Now, what is next? Diastema. Diastema is a gap between the teeth. You can see these two pictures. Like, you can see here something green filled in between the teeth, and as the owner has cleaned the teeth, you can see the space between these two teeth, and because of this space, the normally like animal whatever eats, it gets stuck over here. So such gaps that are abnormal, these are called as diastema. So you should clearly know the difference between interdental space and diastema. Interdental space is normal anatomical space, but diastema is a space between teeth that is abnormal. So uh, that was all about the first part of the equine dental anatomy, and I hope you have uh, uh, gained the knowledge whatever you needed and you understood all. In the next video we are going to talk about the equine dentition regarding aging, like how we get the idea of a horse age from their teeth. So if you want to know about that, uh, make sure you subscribe the channel and watch the next video. Thank you so much.